Miss Polly Esther.
Yeah,
How are you today?
I'm doing well. Thank you very much.
I'm Miss Varghese. I'll be your hygienist today. I saw you completed your MDSH form. I appreciate you doing that. But before we do anything, I just wanted to review a few things on your form, just to make sure that we got everything and we didn't miss anything on there before we, move on to any procedures or anything like that. How does that sound?
Sounds great.
Awesome. So you're in good current health. You're currently under the care of a physician, Dr. Lauren Whitaker, I'm seeing.
Yep.
When was the last time you saw your doctor?
Ooh, I want to say towards the end of last year, probably exactly a year ago, last November.
Okay. Um, and that was just a general visit or like more so a checkup type of?
Yeah, just a general checkup, similar to now. Yeah, I'm just here. No real like big issues, just routine.
Okay, cool. I see you haven't had any serious illnesses or anything within the past 5 years, no implants or artificial devices, no previous history of COVID. I see you did have your COVID vaccine done around 2021, 2022, roughly. Um, no allergies to any medications or foods or anything like that. Awesome. No dietary drugs.
Mm-mm.
No antibiotics that could have been recommended by your dentist that you could remember of.
Nope.
And then for your over-the-counter drugs, I see you're taking some daily multivitamins, omega-3, and occasional ibuprofen.
Yep.
Um, what do you typically take the ibuprofen for?
So for the ibuprofen, I'm usually taking about 200 milligrams as needed for menstrual discomfort. Uh,
Okay.
that's from the endometriosis that I put down. That was taken care of back around 96, and everything went well. I had a certain surgery for that, but on occasion now during some menstrual cycles, I do have discomfort in the pelvic area. Just take that.
Okay. Do you feel like your menstrual cycles have gotten better since the surgery or?
Yeah, they're definitely. It's not common for me to have to take the ibuprofen. Like I put on here, it's occasional. There are some times, but it's not every time.
Right. And do you feel like your cycles are more irregular or are they pretty often every month? Like you get them every single month. There's no
They're pretty regular.
awesome. Um, all right. So for health conditions and disorders, I'm not seeing anything checked off. Oh, I see you did say you've had a previous stroke.
Yes, that's correct.
Okay, when was that?
So the stroke was, I believe, back in 2016. It was an ischemic stroke, and I recovered fully. But my doctor keeps me on a low dose aspirin just to prevent another one from happening. And
Okay.
I feel fine now, but I do get tired sometimes if I'm stressed.
Okay. Have you do you go in and get often checkups for, just to make sure your health is in good condition? Because I know you said that your last time you got checked was at your PCP was almost about a year ago.
Yeah, yeah, that's part of my checkup too, just to make sure that everything is doing well. That was more of a one-off situation. I do have mild atherosclerosis,
Okay,
and my blood pressure was just really elevated at that time, and yeah, that was just a one-off at that time.
I see. I understand.
Hmm.
Um, I see for your serious illnesses, obviously you mentioned the endometriosis, and then you said the rosacea,
Sasha.
rosacea. Okay. How is that? How's that been going?
Yeah, so like I mentioned with the endometriosis, that was in my 20s, back in 96, and I had the laparoscopic surgery for that. And like I was mentioning, I do get mild cramps and some pelvic pain, but it's nothing major. And for the rosacea, I just get like really red and just have some like flare-ups on my cheeks. But for that, it really is more so dependent on certain triggers like heat if I'm like really stressed.
Okay.
And unfortunately, like some spicy foods, it's not necessarily an allergy, but they can be a trigger to it sometimes.
Right. So
Uh,
when was the last time you experienced the rosacea?
I was out in at a park with a friend, and we were just going for a light walk, but I think it was a little too, I was getting a little too warm, and
Too
I
hot
was flaring up.
outside.
Yeah, that was
Okay.
about a month ago.
Okay. About a month ago. Let me jot that down.
Hmm.
Um, Currently not pregnant or trying to get pregnant,
No,
not nursing or taking any oral contraceptives or hormones.
no, no, no.
So 1 second. As far as your dental history, you have routine dental exams done
Uh,
and you're
yes, I do. I try to go every like 6 to 12 months. So,
12 months. And when was your last exam?
this past April, April 18th,
April 18th. And your doctor's name?
Emily Hartman.
Emily Hartman. Okay, and then how do you feel about your dental appointments? Do you get anxious? Are you okay about going to the dentist?
Yeah, I do get a little bit anxious. Yeah, I think I just become too aware of my breathing and yeah,
Right.
nervous. Yeah, but
Is there
not
anything that
nothing too
tends
bad.
to calm you down maybe when you're at the dentist?
I'm sorry, can you repeat?
Is there anything that typically might lighten your mood a little bit when you're at the dentist when you do feel anxious?
I think once I'm there and just like sitting down, I can just kind of just let it pass through. It's definitely like open or nerves more at the start of the appointment.
Okay. I see here that you said you've experienced some dry mouth and some bleeding of your gums.
Yes.
For the dry mouth, do you use tobacco
No, no, I do
or
not.
smoke any cigarettes of any sort?
No, no.
So when do you typically feel like you experience the dry mouth?
Um, it's similar to the rosacea, funnily enough. It's mostly when I'm just really stressed, that kind of comes back up. But
Okay,
and then overnight as well. But that's
okay.
really it. Mm.
I think if we find some things that trigger your stress and maybe um, like if you know you're on the verge of meeting your point of stress, maybe try to find some ways to bring it back down so that you're not hitting that point to where, your rosacea triggers or your dry mouth triggers.
Mhm.
As far as your bleeding gums, when do you typically experience this? Is this while blushing, flossing, or
Yeah, I do brush. I try to brush 2 times a day. I try to be pretty consistent with that. But I do skip my flossing, and I would say that the bleeding kind of comes more so whenever I'm flossing.
I see. Okay. We'll definitely have to get you in to take a look at that because a little bit of bleeding is typically okay, but if it's, a little bit more than normal and every time that you're flossing or every time you're blushing, that
Mhm.
can be a little bit concerning. So, we'll definitely have to get you in to take a look at that. I see you're using a soft bristle toothbrush.
Yes.
And then do you usually use floss picks or string floss or
Yeah, just
water
regular.
pick,
No, just regular string floss.
regular string floss? Okay. And then how many times a day do you brush? You said twice.
Yeah, two
Um,
times a day. Yeah, I try
how
to do
long do
two
you brush
minutes.
for?
About 2 minutes.
And then you said you typically floss about 3, 4 times a week,
That's the goal sometimes.
but sometimes we don't meet that. Okay. I
Yeah.
appreciate your honesty.
Mhm.
And then how long do you typically floss for?
Probably about 2, 3 minutes. Things would put down.
Okay. And then do you have any difficulty cleaning your teeth outside of, I know the bleeding gums,
No, no, not at all.
and you don't live in a fluoridated community, or you do live in a fluoridated community,
Mm,
and you do drink out of bottled water, no tobacco use at
no,
any point,
no.
no alcohol. I see you do consume alcohol socially, maybe 2 to 3 times in a month, and you do like using breath mints, drinking coffee, chewing gum.
Yep.
And is that typically like a everyday thing or
Uh,
coffee once in a every other day thing?
no, the coffee is the daily thing. And the breath mints and the chewing gum, it's just dependent on what's on me. And if dry mouth is there, or if I'm just feeling like I have some bad
Trying to
breath
use
right
that to
there.
relieve the,
Hmm.
I understand.
Hmm.
Um, and how important is it for you to prevent any oral health issues?
Very important. Yeah.
Very important. And do you believe that you have control over the condition of your mouth?
Yeah, I would like to think so.
Awesome. And then let's go over your medications and supplements. Are
Mhm.
you currently taking any medications and supplements?
Yes, I'm taking aspirin, about 81 milligrams once daily to reduce the risk of another stroke.
Okay.
I'm also using metronidazole. It's some topical gel called Metrogel,
Okay.
and I put that on my face like once daily for the rosacea. I've been taking doxycycline, 50 milligrams daily, but that's also daily whenever I'm having a bout of flare-ups, like over like the span of a day or two, or if it's like a really bad week or something. So I put daily, but I'm not taking it every day. It's more so dependent on
So
when I
it's
get the
usually
flare-up.
whenever you're on your cycle that you typically
Yes,
take.
yes.
I understand.
And then I think I mentioned it earlier too, but yeah, the ibuprofen for the menstrual discomfort. And that's as needed.
Okay. Any hormone replacements currently?
No.
Any vitamins, minerals, or herbal supplements?
Yeah, so I've been taking the women's daily multivitamin, one tablet daily. That's just for general health maintenance. And I've also been taking a omega-3 supplement, the fish oil, one soft gel, also daily, and that's for my heart and vascular health.
Okay. Awesome. And you typically keep up with all these as you're supposed to?
Yes, yes, yes. Mhm.
Awesome.
Got my reminders.
Awesome. And lastly, just to go over your radiograph questionnaire, are you employed in any occupation with ex that exposes you to, so sorry, X-rays or any other forms of ionizing radiation?
Oh man.
No. Have you ever had any radiation therapy in the head or neck area?
Nope,
No. Have you been exposed to extensive medical radiographs within the past 5 years?
nope,
No. Have you been exposed to a full mouth series within the past 3 to 5 years?
no,
No. Have you been exposed to a panoramic film within the past 3 years or so?
no.
No. Have you been exposed to a bite wing within the past year?
Yeah, the bite wings we did at my last dental visit, so April 18th.
Okay, so April 18th of this year, you have the bite wings done. Okay, well, thank you so much for this. I've got everything updated, Miss Polyester. So before we do anything or schedule you for any procedures or anything, especially for your bleeding gums, we want to make sure we take care of that. I'm just going to speak to our doctor and go over what's best for you before we proceed with anything. So I'll contact you soon to get an appointment scheduled for your routine checkup and cleaning.
Okay, that sounds great.
Any other questions for me before we proceed?
Uh, no, we can move.
Awesome. Well, you have a great day. I'll be in touch shortly.
Thank you. Bye.
Bye.